Edwards, and let's get this girl talk started with a couple of facts. Fibroids are defined as a common disease that causes an abnormal growth to develop in or on a woman's uterus, creating pain, pressure, and heavy bleeding. Fibroids are compact tumors that any woman can experience during their reproductive years, but are more commonly found in Black women. According to Healthline.com, fibroids are also known as leiomyomas, and they appear as non-cancerous growths and can vary in size or number. Although the cause of fibroids is unknown, according to womenshealth.gov, symptoms of these also includes bleeding, anemia, painful sex, difficulty in bladder function, and in some cases, issues with fertility and complications in pregnancy. And this is just the beginning of our talk.
I want us just, ladies, to talk about some of these symptoms that Taryn mentioned. Like, what have you experienced?
I know for myself, my fibroid journey was about 11 years. And so my symptoms started in the latter half in the last 5 years. But I know one of the things is I had irregular periods. And I would go through phases of either a heavy period or a light period and sometimes no period. And so it was confusing to me because just due to my age range, I thought that maybe I was starting to go through menopause. Mm-hmm. But when in fact, down the line, we figured it was symptoms from my fibroid. Yeah. And every fibroid, the other thing, ladies, every type of fibroid that Taryn mentioned, let me tell you, when you go through my MRI and even go through my sonograms, I had some of all of them. Yeah. So it's more common, than I think sometimes we even realize in so much of our research even. Mm-hmm.
Yeah, absolutely.
Yeah.
Yes.
And Nkem, you were saying something?
Just going to say for me, I experienced the really heavy menstrual bleeding. That was one of the telltale signs of fibroids. At the time, I didn't realize anything was wrong. I had the heavy bleeding. I had bleeding in between periods. I had heavy clotting as well, and I never wanted to wear white because I would fear having an accident, which happened several times in public. So like I said, I didn't think anything was wrong at the time. I sort of normalized it in my own head, but it did get to a point where I couldn't take a few steps without feeling like I was going to pass out. And it was at that point where I said, I have to go to the doctor. Something seems to be wrong. And I went to the doctor, got some blood work done. My blood level, hemoglobin level, which is my blood level, came back a 3. And a normal level is between 12 to 15 for women. So I was at a 3, and they suggest a blood transfusion if you're at a 7. So they ran a host of tests, including an echocardiogram, because I had a cough that wouldn't go away. And they found out that I developed something called cardiomegaly, which is an enlarged heart. So I needed a blood transfusion. They said that the only way to get my blood levels back up to a healthy level is to get a blood transfusion, because at any moment, if I walked out of those hospital doors without getting a blood transfusion, I could risk going into cardiac arrest at any moment. So literally, fibroids almost killed me.
And that story resonates with me so much, Nkem, because I have had 7 blood transfusions due to fibroids for iron deficiency anemia. And, thinking about fibroids and the way it impacts so many different areas of your body, I feel you on that statement that fibroids almost killed me. But Brandi, I know that you didn't necessarily have the symptoms of heavy menstrual bleeding, right?
No, and when I'm listening to you guys' story, it really just, it's like I went through my own thing, but listening to you guys' story is like, wow, there's so many things that I didn't go through. And I think that's where a lot of misconception with fibroids comes in. Because when I found out I had fibroids, the symptoms that I was having was more like bloating, really like always feeling bloated, always being like feeling like I was gassy, but wouldn't be able to pass gas. And with me being a flight attendant, a lot of that went on for months, and me just thinking that was what, I needed to drink more water. I needed to do different things. And never once, when I Googled my symptoms, never once did fibroids come up. So I do think there's so many misconceptions. So I ended up going to, help me out, ladies.
Gastroenterologist.
Yes, that's where I went. And they were the ones that were like, okay, before we do the colonoscopy, let's do an ultrasound. And they were actually the ones, I remember it like it was yesterday, and this was 2015. And they said, it looks like you have free-floating blood in your uterus. So before we can do anything, we need you to go and talk to your OB. We'll send over these test results. And that's how I ended up finding out that I have fibroids. And I think too, when women are just so used to like dealing with symptoms, or like I started my cycle very young at 9 years old. So like, you know, by the time I was in my 20s, it was just like, this is just something that happened. And also, you know, having PCOS and endometriosis, like it all ties in. So sometimes, even though I went to the doctor regularly being diagnosed with PCOS in 2006, and I still, even going every 6 months, never knew that I had fibroids.
And once again, it goes back to all of the symptoms that we have that we don't even know sometimes are related to fibroids. Yeah. What you said, Brandi, was so important about being misdiagnosed. So actually, I think Amber said it, 41% of women go to 2 doctors before they are properly diagnosed with fibroids. And in addition to that, women usually wait between 3 and 5 years before they do anything with their fibroids. So y'all, can you imagine going through these symptoms for 3 to 5 years, not doing anything about it, but also maybe not even really knowing what's going on in your body? Taryn, what was your experience?
It was the first year that I started experiencing heavy bleeding, cramps for the first time, because I never had cramps ever in life. I didn't really have a heavy period ever. It was extremely light, and I started my period at 14. So it was when I was working in my job, and I work in the laboratory, and I'm wearing my white lab coat, but I started feeling paranoid because my period was heavy, and I was going through about 5 or 6 pads during the course of the day, and changing and running to the bathroom as often as possible. And that's when I knew something was wrong. So I made my first appointment, and I asked the doctor, can you check to see if there's something wrong with me? And she said, no, there's nothing wrong. Sometimes it's heavy. And so I went back home, and I talked to my aunt, who was a nurse, and she said, well, sometimes it's heavy, but if you think it's something wrong, then make another appointment. So I made another appointment with the doctor. And this time she said, yeah, well, I noticed it's heavy. So then she put me on some birth control pills, the ones that give you like 3 or 4 periods throughout the year.
Oh, the Yaz?
Yeah. It didn't work. So then she had me to schedule another visit. And then I got a sonogram, and they found the fibroids on that 4th visit. But this is in the same year, because it was just bothering me because I was messing my clothes up. And then she also gave me the Lupron shot, which gave me premenopausal conditions, and it stopped my period until the surgery was scheduled, which ended up being in January. So that was like in November, I got the Lupron, and the actual surgery was in January. And that was when I did that all within the course of a year. I did get a second opinion just for my own sake, and that person found fibroids too. So that's my story.
Yeah, that's so interesting that, like, imagine having to go through all of that in a year, right? And it's like, I don't even think sometimes we even think about that.